For many women, the transition into menopause is synonymous with hot flashes, night sweats, and mood swings. However, there's a frequent and often debilitating symptom that doesn't always get the same level of attention: joint pain. Statistically, over 50% of women transitioning through perimenopause and menopause report significant joint stiffness and aching, often referred to as menopausal arthralgia. This discomfort can range from a dull, nagging ache in the morning to sharp, stabbing pains that interfere with daily activities. But because these years also coincide with the natural aging process, many women wonder, is this just a normal part getting older? Is it the menopause? Or is it a more serious underlying condition, like rheumatoid arthritis? This comprehensive guide explores the relationship between hormones and joint health, how to distinguish menopausal pain from other conditions, and the various ways to manage and treat this silent symptom of the change. The hormonal connection: why menopause hits the joints. To understand why your knees, hips, or fingers are suddenly throbbing, we have to look at the primary hormone in decline during menopause: estrogen. Estrogen as a natural anti-inflammatory. Estrogen is not just a reproductive hormone. It plays a vital role in the musculoskeletal system. Estrogen helps regulate fluid levels in the body, including the synovial fluid that lubricates the joints. It also has a protective, anti-inflammatory effect on the tissues. When estrogen levels plummet during perimenopause, it triggers a cascade of physiological changes that directly impact joint health and comfort. First, the reduction in estrogen leads to a significant rise in pro-inflammatory cytokines, which increases systemic inflammation and leaves joints feeling swollen and painful. Beyond inflammation, the structural integrity of the joint is often compromised because estrogen is essential for maintaining healthy cartilage. As levels drop, this protective cushioning between the bones can thin, potentially leading to increased bone-on-bone friction. Furthermore, because estrogen plays a critical role in how the body retains water, its decline results in the dehydration of connective tissues. This leaves ligaments and tendons less hydrated and less elastic, making them significantly more prone to stiffness, reduced range of motion, and injury. Is it normal menopausal pain or something more? Distinguishing between normal menopausal aches and chronic conditions like osteoarthritis, OA, or rheumatoid arthritis, RA, is crucial for proper treatment. Menopausal arthralgia, the normal, aches. Menopausal arthralgia is a unique form of physical discomfort characterized by pain that is specifically linked to the significant hormonal shifts occurring within the body. This discomfort is most frequently localized in the hands, wrists, knees, hips, and spine, often manifesting as a deep ache or stiffness. Many women find that the pain is at its peak during the early morning hours when the joints feel most rigid, though it typically begins to ease as they move around and the joints warm up through activity. Furthermore, the duration and intensity of these aches are not always constant. Instead, they may fluctuate in alignment with changing hormonal cycles, particularly during the perimenopausal phase when estrogen levels are at their most erratic. Osteoarthritis, OA. OA is a degenerative wear and tear disease. While menopause doesn't cause OA, the loss of estrogen can accelerate its progression. If the pain is localized to one specific joint, like the right knee, and gets progressively worse with heavy use, it may be OA. Rheumatoid arthritis, RA. Rheumatoid arthritis, RA, is an autoimmune disorder that differs significantly from standard menopausal aches. Yet interestingly, its peak age of onset in women often coincides with the menopausal years of the 40s and 50s. To distinguish RA from hormonal joint pain, you should look for specific red flags, such as morning stiffness that persists for more than an hour or pain that is symmetrical, affecting both hands or both feet simultaneously. Additionally, if you notice significant swelling, redness, or warmth in the joints, these are indicators of an underlying inflammatory process that requires professional evaluation. If these symptoms are present, it is crucial to consult a rheumatologist to ensure an accurate diagnosis and prevent long-term joint damage. Fibromyalgia. Menopause and fibromyalgia share many symptoms: brain fog, fatigue, and widespread muscle/joint pain. Sometimes, the hormonal drop can trigger or worsen fibromyalgia symptoms. Contributing factors. Why some women suffer more. While not every woman will experience significant joint pain during menopause, Several lifestyle and physiological factors can substantially exacerbate these symptoms. A primary contributor is menopausal weight gain, often concentrated in the midsection, which significantly increases mechanical stress on the body. In fact, for every extra pound gained, an additional 4 pounds of pressure is exerted on weight-bearing joints like the knees and hips. This physical strain is often compounded by the emotional stress of the transition, which triggers the release of cortisol. As a pro-inflammatory hormone, elevated cortisol not only fuels systemic inflammation, but also lowers the overall pain threshold, making existing aches feel far more intense. Furthermore, because declining estrogen reduces the body's ability to retain moisture, chronic dehydration can set in, directly impacting the production of synovial fluid and leaving joints poorly lubricated. This often culminates in a vicious cycle with menopause-induced insomnia. Lack of restorative sleep prevents the body from effectively repairing joint tissues and heightens the brain's sensitivity to pain signals, transforming manageable discomfort into a chronic daily struggle. How is menopausal joint pain diagnosed? When you consult a healthcare professional for persistent joint pain, they will typically conduct a comprehensive evaluation to differentiate between hormonal changes and more serious underlying pathologies. This diagnostic process often begins with blood work to identify systemic inflammation through markers such as C-reactive protein, CRP, and erythrocyte sedimentation rate, ESR, while also screening for autoimmune conditions like rheumatoid arthritis using rheumatoid factor, RF, and anti-CCP antibody tests. To determine if your symptoms are indeed linked to the menopausal transition, doctors may order hormone panels to measure your follicle-stimulating hormone, FSH, and estradiol levels, which help confirm your current stage of perimenopause or menopause. Additionally, imaging studies play a vital role. X-rays are commonly used to detect structural changes like bone spurs or narrowed joint spaces, while MRIs provide a more detailed view of soft tissues to assess for early cartilage loss or significant joint damage. Management and treatment options. Hormone replacement therapy, HRT. For many women, the most effective treatment for menopausal arthralgia is replacing the missing estrogen. Studies have shown that women on HRT often report a significant reduction in joint pain. By stabilizing hormone levels, HRT reduces systemic inflammation and helps maintain joint lubrication. However, HRT isn't for everyone, such as those with a history of certain cancers, so a detailed discussion with a specialist is necessary. Nutritional interventions, the anti-inflammatory diet. What you eat plays a definitive role in your physical comfort, as nutrition can either fuel the fire of inflammation or serve as a potent tool to fight joint pain. Incorporating foods rich in omega-3 fatty acids, such as salmon, walnuts, and flax seeds, is essential, as these healthy fats act as powerful natural anti-inflammatories that support joint health from the inside out. Similarly, incorporating spices like turmeric and ginger into your meals provides active compounds, specifically curcumin and gingerol, which have been scientifically shown to inhibit inflammatory pathways in a manner strikingly similar to over-the-counter medications like ibuprofen. For a more comprehensive approach, many experts recommend the Mediterranean diet. By focusing on a diverse array of fruits, vegetables, whole grains, and heart-healthy olive oil, this dietary pattern is scientifically proven to lower systemic inflammation markers. Conversely, it is equally important to eliminate pro-inflammatory triggers. Reducing your intake of refined sugars and highly processed foods is vital for preventing the painful joint flares and metabolic stress that often accompany the menopausal transition. Targeted supplements. Targeted supplementation can provide an additional layer of support for the musculoskeletal system during the menopausal transition by addressing specific nutritional gaps. At the foundation of this approach are vitamin D and calcium, which are vital for maintaining bone density, to prevent osteoporosis, and ensuring proper muscle function. To complement bone health, magnesium plays a crucial role in facilitating muscle relaxation and can significantly improve the quality of sleep, which is often disrupted during this time. For direct joint support, many women incorporate glucosamine and chondroitin. While individual results can vary, these supplements are frequently used to help maintain and support the structural integrity of cartilage. Finally, supplementing with collagen peptides has become increasingly popular as a way to provide structural support for connective tissues, such as tendons and ligaments, that estrogen no longer protects as efficiently, helping to maintain overall joint flexibility and resilience. Physical activity. The paradox of movement. Though it may feel like a paradox, movement is often the best medicine for menopausal joint pain, even when aching limbs make exercise the last thing you want to do. Engaging in low-impact aerobics, such as swimming or cycling, provides a vital way to maintain joint mobility and circulation without the repetitive stress and jarring impact associated with running. Perhaps most importantly, strength training serves to fortify the muscles that support your skeleton. By strengthening the musculature surrounding a specific area, such as the quadriceps for the knees, you effectively offload the physical pressure from the joint surfaces themselves. Complementing these efforts with practices like yoga or Pilates further enhances physical resilience by improving flexibility and core stability, both of which are essential for maintaining proper posture and healthy joint alignment. Lifestyle adjustments and alternative therapies. Addressing lifestyle adjustments and alternative therapies can provide significant holistic relief from menopausal joint discomfort. Maintaining optimal hydration is fundamental, as aiming for 2 to 3 liters of water daily ensures that joint tissues remain hydrated and synovial fluid, the body's natural lubricant, stays at healthy levels to prevent friction. For those seeking non-pharmaceutical options, many women find meaningful relief through regular acupuncture sessions, which can stimulate the release of pain-relieving endorphins and improve localized blood flow. Daily symptom management can be further enhanced using targeted thermal therapy. Soaking in a warm bath enriched with Epsom salts allows the body to absorb magnesium, which effectively soothes stiff morning joints and relaxes tense muscles, while applying ice packs after physical activity helps to numb acute swelling and calm inflammation. Ultimately, managing body weight remains one of the most impactful long-term strategies, as losing even a modest 5 to 10 pounds can drastically reduce the mechanical load on weight-bearing joints, removing up to 40 pounds of pressure from the knees, while simultaneously decreasing the systemic pro-inflammatory chemicals produced by excess fat tissue. The mental health aspect. The brain-pain connection. Chronic pain is exhausting. When combined with menopausal mood swings or anxiety, it can feel overwhelming. Cognitive behavioral therapy, CBT, has been shown to be effective in helping patients manage pain catastrophizing, the mental cycle where we worry the pain will never end, which actually increases our perception of that pain. When should you be concerned? The red flags. Although joint pain is a frequent and expected part of the menopausal experience, it is critical to recognize specific red flag symptoms that signal a need for urgent medical intervention. You should seek professional advice immediately if you observe a visible deformity, such as a joint that appears crooked or out of place, or if you experience severe swelling where the skin is noticeably hot to the touch. Pain that is accompanied by a fever is a particularly concerning sign, as it can indicate a serious joint infection known as septic arthritis. Furthermore, any sudden loss of function, such as an inability to bear weight while walking or the inability to use your hand due to intense pain, should be evaluated by a healthcare provider right away to rule out acute injury or more serious underlying pathology. Conclusion: you don't have to just live with it. The most important takeaway is that menopausal joint pain is real, it is biological, and it is manageable. It is not all in your head, nor is it an inevitable sentence of misery for the rest of your life. By understanding the role of estrogen, optimizing your nutrition, staying active, and potentially exploring HRT, you can navigate the menopausal transition with significantly less pain. If you are struggling, don't dismiss your symptoms as just getting old. Speak to a healthcare provider who understands the complexities of the menopause transition. Your joints and your quality of life depend on it.